This is Coronavirus House Calls.
Well, thanks for joining us for Coronavirus House Calls on this Saturday. I'm Art Franklin. We've seen a number of developments in our country since our last show. Although the number of coronavirus cases in the United States continues to rise, so is the death toll. Here's what a lot of people are talking about right now: reopening the country and testing. No doubt those issues will be part of the discussion today as well. But of course, this Nexstar digital program is all about the questions we got from you, those of you in your homes all across America. Our panel of health experts is standing by with the answers you're looking for. So let me show you who's with us today. Dr. Michael Sag, UAB's Associate Dean for Global Health and Director of UAB's Center for AIDS Research. Also joining us is Dr. Marka Lee Alexander. She's a physical medicine and rehabilitation specialist. Dr. Alexander is also the president of Telerehabilitation International. Both of them are regulars on this program. Joining us for the first time is Dr. Italo Brown. Dr. Brown is an emergency medicine physician and clinical instructor at Sanford Hospital, as well as an expert in health disparities. He's also no stranger to the camera, capturing the attention of millions in an episode of GQ's web series, The Breakdown. And finally, we have Dr. Shana Ali, who you met last week. Dr. Ali is a mental health counselor, educator, and advocate who owns a practice in Orlando, Florida. Dr. Ali has been honored with multiple awards for her counseling work, so let's get right to it right now. You've met this panel, so we want to get right to some questions with them. But before we get to your questions at home, I want to ask Dr. Sag about this issue of reopening the country. It seems as if the big question surrounding when to do that is, are we ready for contact tracing, and are we testing enough people to reopen the nation and be safe, Dr. Sag?
Well, thanks, and thanks for having me. The big question to me is not when do we reopen the country, it's how. Because if we take it just to, let's say, a null, where we just simply say we've had 3 months of social distancing and stay at home, and then we say, okay, let's go back to normal, it's no different than we were on March 1st, and we're going to get the dreaded second surge. We're going to get a spike in cases again because the virus is still here and people are still susceptible. There have been hundreds of thousands of people, as you've alluded to, who've been infected with the virus, but our country is 330 plus million people. So that means the majority of us are still susceptible. So what we have to do, and this is where the concept of testing comes in, is treat this like we do tuberculosis. Get a case of TB in the community. The health department comes in, tests, identifies, treats as we can, but then looks at all the contacts in the immediate circle of that individual. And what happens there is that they test those individuals, find out if they're infected, isolate them, and quarantine the original person. By doing this aggressive testing and case contact tracing, then we're able to get this under control, and we can release the stay-at-home restrictions gradually with a safety net.
All right, Dr. Sag, I want to stick with you for a minute now. This is a question from Juliana from San Francisco, watches KRON 4 News there. And here's the question for you, Dr. Sag. How long can asymptomatic persons have the virus, and is the carrier's health at risk?
Well, there seems to be a lot of people who are asymptomatic. What does that mean? They basically have the virus and they don't get sick. The thing is that during that time, they can still transmit the virus. The length of time that they're probably carrying the virus and can be infectious is really not completely known, but the best estimates are 10 to 14 days. The thing that we have learned in the last couple of weeks is that, let's say somebody does develop symptoms, they are most infectious about a half a day before their symptoms develop. So think about releasing people back from the stay at home. Somebody can go to a restaurant, feel great, and then 6 hours, 7 hours later, they get sick. Well, while they were at the restaurant, they were a super spreader. They were spreading the virus to a lot of people. The thing that will change us dramatically is not just, as I mentioned earlier, the case contact tracing like we do in TB or a vaccine, but that's 12 to 18 months away. The thing that'll be a game changer is treatment. So imagine the world where we have somebody who's diagnosed, like the person I just described. They get symptoms, and we immediately bring them in for treatment with an antiviral that shuts the virus down and lets the immune system take over. And that would prevent them, A, from getting sick, and will shut down their time of spreading the virus dramatically. So there's now a drug that's, just yesterday, some news came out on remdesivir, and that drug has been found in very sick people at the University of Chicago to shorten the time on a ventilator and to allow people to leave the hospital. Among people with non-ventilators that they just were sick in the hospital, got the drug, they left the hospital seemingly much earlier. Does that mean it should be released now? No, because what we need to do is have the randomized trials, which are underway, and I think we'll have data from that in May, so stay tuned.
Stay tuned, showing some progress there and see what happens with that. I want to go to Dr. Brown now. Welcome to Coronavirus House Calls, Dr. Brown. This is a question from Elizabeth in San Diego, California, watches Fox 5 there. Here's a question. If I have an emergency and need to go to the ER, is it safe? Are COVID-19 patients separated from emergency rooms?
Well, it actually depends upon the type of ER that you go to, right? So several people will go to an urgent care. These tend to be like a secondary tributary. The ERs that I've worked in have COVID wings for the most part, whereas if a patient comes in with a respiratory complaint, they're automatically taken to this particular respiratory wing where we have isolation rooms, negative pressure rooms, things that are pretty standard in trying to address this complaint. Now, I don't think that there should be any apprehension to coming, especially if you have severe symptoms or symptoms that would be enough to warrant a visit. There's also other testing modalities. People are doing drive-through testing, tents. So all of these typical modalities are present at a standard emergency department. So I definitely wouldn't hesitate coming.
So Dr. Brown, I'm assuming that you guys are learning more and more as we go along with this pandemic.
Yes, absolutely. I mean, it is rapidly evolving in terms of our understanding and more particularly our operations efficiency. So I've seen it start off initially as just we triage patients and then try to figure out in a standard setting whether or not this case could potentially be COVID, to now where we're able to take complaints and people will call in before they even present to the emergency department, which has been extremely helpful, and we can prepare for them and figure out the right approach.
Very well, Dr. Brown, thank you there. Dr. Ali, let's turn to you now. This question sent in from Mary from Alexander, Arkansas, who watches Fox 16 television there. She says, you can't stay 6 feet away from someone who's trying to start a fight with you over toilet paper. How can I get others to respect my personal space when I'm shopping for essentials? I know it makes you laugh, but I guess a serious question from her.
It is a serious question, and this is not the first time I'm hearing a question like this. I think that it's important to recognize that this is a stressful situation for many of us, and people respond to stress in different ways. And some people are having their emotions run high. We're hearing a lot about worry and fear, but a lot of that can come out in anger as well. Now, Mary, what I think is important for you to recognize is you can't really control other people, but don't lose sight of how you can manage yourself. So something to think about is, because we're all going through this, maybe the person that's being a little bit more argumentative and combative in the grocery store is going through a lot right now. Now, does it make that okay? But maybe that can help you to understand where they're coming from. Now, it is still important for you to be assertive about your boundaries. Keeping that in mind, we're still kind of adjusting to more of these social distancing and stay-at-home orders, although it feels like it's been a long time. It hasn't been that long. On the other hand, the habit of going to the grocery store and acting like normal, that's what we're accustomed to. So some people might actually be getting into your space and not meaning it. So keep that in mind, step back when you can. Now, of course, be assertive when needed. You can always say, excuse me, but of course, if it's getting to a level that it's combative, there's usually security in these grocery stores that you can seek assistance from as well.
Well, Dr. Ali, we believe last week you saved a marriage when you answered the question there. It's so important for people to really use patience and practice some patience when we're dealing with social distancing, when we're talking about staying at home and quarantining during this pandemic.
Absolutely, and patience is difficult in that time. So even if you catch yourself, recognizing that is the first step to say, how can I be more patient for myself, for my family, but for my community too?
All right, thanks a lot, Dr. Ali. Let's go to Dr. Alexander now. This question from Bonnie from Portland, Oregon, who watches KOIN, Coin News there. She says, I am a 72-year-old woman in very good health. I'm very active and have no underlying health issues. My only medication is a baby aspirin taken daily. I take a variety of healthy supplements. Am I considered high risk?
Well, Bonnie, if you look at the guidelines, you are still considered high risk. Having said that, there are different spectrums of the term high risk. So if you got coronavirus, would you get as sick as other people would? Probably not. But that doesn't mean you're not high risk. You still need to practice your social distancing and stay healthy. If you went out into an environment where there are a lot of people with the virus, you'd probably get very sick. So take care of yourself, stay safe, and that will help you be on the low end of high risk.
Dr. Alexander, what is that guideline? Is it 60 and above, 65 and above? What are we talking about?
I've seen different things, 60 and above, and also 65 and above. The thing is, when you are older, it's worse when you do have the comorbidities, such as we're seeing extreme obesity is an issue, diabetes, cancer, and other significant health problems such as cardiac disease. So, you know, there are actually 97-year-olds that have survived coronavirus. So it's a spectrum of how healthy you are to start with, but those are the guidelines.
All right, thanks a lot. Let's go to Dr. Sag now. This question is from Iberico in Chicopee, Massachusetts, who watches WWLP 22 News. The question is this: is testing going to be made available to everyone when it comes time to lift the quarantine? Dr. Sag?
I sure hope so. We really need it. The testing is actually, there's two types of tests. The first is the test for the virus itself. That's the nasal swab or the oral swab. And that's looking for the virus itself. And we use that to see if somebody with symptoms has infection or if somebody's been exposed and they might be asymptomatic. The other test that's probably even better for the large population is the antibody test. So what that tells us is whether or not somebody has been exposed to, infected with the virus, maybe didn't have any symptoms, but then developed an immune response that we would detect as an antibody. That antibody is just a protein in the bloodstream produced by the immune system. But it's like a track, it's like a bear track in the woods that you can say, okay, a bear's been here. Well, here the bear track is the antibody and says the virus has been there. So what we can do with that antibody test is we can start randomly testing people in the community, and we can even look for clusters of where infection has been particularly high incidence, so that like a hot spot, and we can then focus more on that region of the county, of the city, or even a community, and be more aggressive about social distancing perhaps there, and then work backwards and start looking at the other folks in the community. So testing is really an essential part of relaxing these restrictions. I think you're hearing that from multiple sources right now.
Yeah, we're hearing that over and over again, that testing is so important as we determine when to actually reopen the country. Let's go to Dr. Brown now. It's a question from Lulu in Little Rock, Arkansas, watches Fox 16 News there. Lulu says the Surgeon General has advised Latinos and Black Americans to avoid alcohol, drugs, and tobacco. Even if this were to somehow happen overnight, is this supposed to stop the coronavirus from killing Latinos and Black Americans at a disproportionately higher rate?
I think that the main thing to note here is that there is a systemic issue, that there are multiple medical problems that African Americans and Latinos have been placed at higher risk for because of health disparities and social determinants of health. These are things that for the last 15 years, researchers and professionals in the field have brought to the attention of both the federal government as well as the healthcare system. And they've worked collectively to try to create an approach to lower the risks that African Americans face for chronic diseases such as high blood pressure, diabetes, cardiovascular disease, kidney disease. These are things that tend to decimate African American and Latino communities. Now, with substance use, I'm sure that this is something that any person across the spectrum would benefit from reduction. But I don't know if I would say outright that changing these risk behaviors alone would lower risk of catching COVID-19.
And Dr. Brown, when the Surgeon General made mention of this in one of those White House press conferences, took a lot of heat about what he said. But I think what he was trying to talk about was those health disparities and to bring that information out because of all of the underlying issues there.
This is a very real conversation, and one that has been literally on the brink of becoming a dining table conversation among families. And it's very unfortunate that it took something like this to really uncover, or unveil rather, the true disparities that exist. I mean, it's very difficult for people from communities of color to socially distance effectively, particularly when you're talking about living in households where there are grandparents, other family members. I mean, that's almost unrealistic. And then take into account that there are multiple medical issues that African Americans are at a higher risk of possessing, and then still having to get care for those things. So it's literally becoming a life or death situation for African Americans and Latinos, as they are at greater risk, that we can see based upon CDC's latest numbers.
Well, the important thing now is that at least the information is out there, and perhaps there'll be more discussion about that. Let's go to Dr. Ali with this question now, and it's from John in Columbus, Georgia, who watches WRBL News 3 there. John asked this question: what programs are in place to deal with the mental health suffering that will result from the crashing economy? What about increases in suicide, substance and physical abuse, depression, anxiety, also crime that we're seeing as well? Dr. Ali.
This is a great question, John. And like you, I'm curious too about what programs will develop and be in place for this. I have to tell you, I am hopeful about this because I'm noticing that a lot of health professionals across the globe, especially those of my colleagues who are in the field of mental health, are recognizing that, of course, in light of the increase of stressors, there's going to be an increase of mental health concerns as well. Now, I'm not sure what's going to be unveiled for after this in dealing with getting back to and adjusting to what used to be our normal from our new normal. However, I am noticing things start to shift to align with that direction. So, for example, the National Alliance on Mental Illness is encouraging mental health professionals and mental health advocates alike to advocate for action in Congress. I also saw that there was an emergency grant that was put out by the Substance Abuse and Mental Health Services Administration. So I'm noticing that momentum there. I'm not seeing anything yet about adjusting. However, we are still trying to face this in the crisis zone that we are in. So I don't think that it should be discouraging that nothing's been enacted just yet. Those waves are coming, and I'm optimistic that we will be able to rise to this challenge together.
Dr. Ali, thanks a lot. Let's go over to Dr. Alexander now. This question sent in by Karen from Denver, Colorado. Karen watches Fox 31. And this is the question: are there any exercises we should be doing to keep our lungs stronger? And I'm hearing that from a lot of people, Dr. Alexander.
Yes, there are some exercises that have been circulating around that are starting to be popular, actually. And one exercise that you can do is take a deep breath in, hold it for 5 seconds, and then let it out. And you do this 5 times. So if I was going to imagine this is my third breath, and after you do it 5 times, on the 6th breath, coughing, covering your mouth, trying to expand your lungs and then get your breath out. And there is something, though, in these exercises, aside from just expanding the lungs. Expanding the lungs is great, and that is good for you. But when you take time and you hold your breath for those 5 seconds, you're also learning to relax, and you're also taking care of yourself. So that's one of the forms of exercises that is out there. There's a whole set of exercises, though, that has been known for a long time from yoga practice. It's actually called pranayama. And one of the things that they teach you to do in yoga is something called alternate nostril breathing. And you can do this by putting your fingers up to your nose. And then what you do is you take a deep breath in from one nostril, then you move your finger over it and you let it out of the other nostril. Then you breathe in from one side and out from the other side. So these exercises, what they're doing is they are relaxing you in the process, but also expanding your lungs. One more exercise, there's something called kapabala, and this is to strengthen your diaphragm. And with this, what you do is you go, you're breathing out from your diaphragm. You don't want to be doing that, obviously, if you've gotten people around you, because you'd be squirting out virus if you had virus. But again, it's a way of expanding your lungs. And then finally, the other technique that's been shown to be very helpful, and they've done it a lot in hospitalizations, is an old technique we have, which is called postural drainage, which is basically what people are doing now is laying on their stomachs. And it's advocated that you lay on your stomach for 5 minutes, and this helps drain your lungs. So a combination of these techniques are something that would be useful for people to do, not just for COVID, but also to strengthen your lungs and to relax.
So as I listen to you, Dr. Alexander, are you saying that if we did those exercises, should we contract the virus, it might help us get over it?
Well, that's something that is not proven. For instance, we have heard people say that this has been beneficial for them, but we don't have the time to do specific research techniques now to see if this is going to be beneficial. That's much complicated. So this won't be harmful. So it's worth doing.
Yeah, but I'm going to listen to that advice. I'm going to learn some of those breathing exercises. Thank you, Dr. Alexander. Let's go to Dr. Sag now, who answers this question that was sent to us by George in Denver, Colorado, watches on KWGN Channel 2 there. And George says, my grandson has the virus right now and is slowly bouncing back. However, he mentioned wanting to donate his plasma antibodies. At what point in one's recovery is it safe to donate plasma?
Well, assuming that the source person, the patient, is not anemic, generally speaking, we'd like to wait at least 2 weeks after the symptoms have gone. Some plasma donation centers require a negative test, a negative swab. My personal belief is that within 2 weeks after having illness with no symptoms is a very, very low likelihood that any virus is still present. So I think it would be safe to donate plasma at that time. And what the questioner is referring to is that there are some approaches to therapy where a person who's had the infection donates blood, the plasma, that's the non-cellular part of the blood, is then transfused into a patient with advanced COVID disease, pretty sick, and that helps that person recover. That was used a lot in Ebola back in the day.
Okay, Dr. Sack, thanks a lot. Let's go to Dr. Brown now. Question from Tanya in Woodland, Washington, who watches Coin News there. Tanya says, I live in an apartment complex for low-income senior and disabled residents. If someone here were to get sick and be hospitalized, would health officials let us know and test us?
So I don't think that there's currently any particular rules around this unless you are in an assisted living facility, a skilled nursing facility. These are places where they do have to report it. And in fact, when the patient comes to our hospital, we will test prior to a discharge to make sure that, and this is for any medical complaint, we'll test prior to discharge, and then we'll notify the facility. But if it is like a standard apartment, one where people are living in their own individual settings, it's not mandated that they have to report it to the owners of those apartments.
All right, Dr. Brown, thanks a lot. Let's get back over to Dr. Ali now. Adia from Coventry, Rhode Island sent us a question. Adia watches WPRI 12. Adia says, my daughter just tested positive with no symptoms. I am a nervous wreck thinking about how high my chances are of getting this. Help.
Adia, I think that this is a very complicated situation here. I hope that your daughter stays at that level of being asymptomatic, but it sounds like you are trying to be cautious and making sure that it doesn't spread from there. Not sure how old she is, but for the sake of this, I'm going to assume that she is under your care and that she is young to need your care. The CDC has released really helpful guidelines that can help you to still try to manage what you can in your environment at home related to cleaning and hygiene. But I also think it's important for you to recognize that the stress of that situation can start to wear you down and burn you out. So Dr. Alexander shared some wonderful breathing techniques. I think it's important for you to also recognize how you can foster your mental hygiene during this time. So different methods such as those breathing techniques that were shared, other methods for essential self-care, like getting adequate nutrition, hydration, that's going to be important for not just her, but also you, so you can better take care of yourself and then help her as well.
Yeah, and especially like Dr. Alexander said, those breathing exercises help you to relax, and that's so important to do when you're under a lot of stress. Dr. Sack, let's get back to you now. A question from Billy in Knoxville, Tennessee. Watches at WATE 6 on your side there, and Billy's asking this question. When the stay-at-home order is lifted, will it be safe for seniors to go back out into the public?
Well, it depends. As we talked about earlier, I don't think stay-at-home is just going to be suddenly lifted and we'll go back to what used to be normal. We're going to probably ease into this. So the first part will be initiating of tracing, case contact tracing, and opening up some businesses. My personal recommendation as we're easing out of this is for everyone to wear a mask when they go in public. There's two reasons for that. One is that if that person has the infection and they don't know it, for example, and they cough or sneeze, then it's contained inside the mask. But a second benefit of wearing a mask is that it prevents us from our normal activities of touching our face because the mask is there, and that would make it safer. As far as seniors going out, I think we'll just ease into it and go out, keep social distance of 6 feet, wear a mask, go do what you're gonna do, and then come back home. That's what I would do initially, and hopefully case contact tracing will begin to be implemented and we'll all be safer for that.
Well, Dr. Sag, if I can follow up with that, I have a 94-year-old mother in the Detroit area. She tells everyone, stay away from my home. She doesn't want to go out, and she says she hadn't been out since the second week in February. And when this is over, she says she probably won't go out again until next year sometime. And I think a lot of seniors, especially at her age, thinking about, we want to stay away from this.
Absolutely, and I can understand it. I think at the end of the day, if she is going to be isolated for a year, she'll need to be talking to Dr. Ali a bit because that sounds pretty stressful. But the take-home point is that I think as we see we're having success, we don't see the spike, that whatever we're doing, say in the Detroit area, is keeping the cases under control. I think there might be a time when your mom can venture out a little bit, just take a walk, wearing a mask, by herself perhaps, or with someone else who's also wearing a mask. And I think that we can ease into this. What we don't want to do is jump right back into what used to be normal, because I'm worried that we'll have a second surge of cases.
Yeah, just to let you know, my mom is pretty humorous, Dr. Sag. She says that with a lot of humor. Don't come in here. I'm not going out there. I'm going to be all right. She laughs about it, keeps going. She already says, I'm 94 now. I'm working on 100. So I think she's going to be all right.
Sounds like a smart lady, actually.
Dr. Sag, thanks a lot. Let's go to Dr. Brown now. This next question submitted by Lori from Paxton, Illinois, watches WCIA 3 News there. He says there's been a lot of discussion about the lack of PPE for medical providers in the United States. How many direct providers have died from COVID-19 exposure? And I don't know if you know that answer, Dr. Brown, but
no, I can't honestly speak to the exact number, but I would say that it's one too many. To be completely transparent, I trained in the Bronx, New York. I have friends that are there. And whenever I hear this conversation about the lack of PPE, even seeing the effects of its scarcity here, it really, really is a disheartening thing. It's almost like sending somebody into a battle without a shield or without any type of armor and expecting them to fight. And so that is one of the most difficult things to kind of overcome as a provider. And I just commend all of the healthcare workers who are still going into work, nevertheless, despite having inadequate preparation and inadequate PPE. I do think that there is some changes being made, more specifically around access to the PPE. I do appreciate policies that have changed in terms of allowing other people to provide it. And then we also have gotten a little bit better at determining which kinds of cases that need full PPE as opposed to just surgical masks. But at the end of the day, I do think that any death that comes from lack of having protective equipment is one too many.
Well, you talk about your friends in the New York area, which is ground zero for the pandemic here in the United States. Are they feeling more comfortable now that maybe they're going to get what they need, or are they still concerned that it's just not happening?
Well, the scarcity of resources has become, it's boiled over to a point where now people are accepting that we have to do this with whatever resources are available. I mean, it's gotten to a state where there are individuals who are donating ski goggles to help as protective equipment. And there are people who are coming from other cities and to work in New York hospitals, basically to be support and more importantly, to work as brothers and sisters in arms against the fight against COVID-19. I do appreciate that emergency medicine has become a lot more closely knit within the last few weeks, because it's very difficult when you think about coming home and not being able to interact with a loved one, or having to sleep in your garage or in a tent in the backyard to isolate from individuals that you care about. So we've leaned on each other as a strength of support, and we go to work and fulfill our duties.
Yeah, that's very tough. And speaking of support, let's talk to Dr. Ali about this question from Didi in Oklahoma City, Oklahoma, watches KFOR TV. And Didi asked this question: I just had a major panic attack. I need help. There's no family I feel comfortable leaning on. It seems like she really needs some help.
Absolutely. Didi, first I want to say I'm sorry that you're experiencing this. Panic attacks are really scary, and it also sounds like you don't feel supported. So being unsupported and in this very stressful time, that's really difficult, and I'm so sorry that you're going through that. However, I also want to highlight that you're not alone and you're not without any resources. So while it may be unfortunate that you do not feel like you have any individuals in your direct community that you can lean on, there are resources available for you. The first thing I want to highlight, especially because panic attacks I like to take seriously and make sure we're getting the help that we need, is telemental health. So we might not be able to go into a therapist's office like usual, but a lot of therapists have transitioned to providing services online at this time. And I think it's important for you to be proactive about that. Some other resources that could be helpful are online communities, support groups. So you mentioned your family, but I'm not sure if you have other individuals that you know from across in different towns, across states, across the globe, really. But even if not, there are online communities that are existing to help support during this time, such as those through the National Alliance on Mental Illness. Also, of course, if this gets to a concerning level, knowing that there are also resources such as the Disaster Distress Helpline from SAMHSA, and that number, in case you need it, is 1-800-985-5990. And if your mental health becomes at a crisis level, in addition to calling 911, you can also reach out to this National Suicide Prevention Lifeline, which is 1-800-273-TALK. But again, I really encourage you to reach out for help, especially from a therapist in your area.
Dr. Ali, you mentioned telehealth. There's no one who knows that better than Dr. Alexander. We're going to give Dr. Alexander the last question for this program, sent in by Lisa from Rochester, New York, who watches News 8 there. And Lisa says, I'm a home health care worker, and I want to know how to protect myself. My employer doesn't provide PPE. They say the person I care for is supposed to provide it, but most are on Medicaid or Medicare, and it's not covered. How do we provide appropriate care if we can't get the supplies we need? Dr. Alexander.
Well, Lisa, I understand your dilemma. What you're going to need to do here is take this into your own hands. The employer should provide you PPE, and there have, in fact, been many OSHA or Occupational Safety and Health Administration comments about that, and people have been complaining about this. Having said that, you probably don't have the ability not to go to work, and the person or the people you're caring for really need your help. So I would strongly suggest that You make your own PPE. You use some of the techniques that are available online to take a scarf, wrap it up. You can take a scarf and actually use the hair bands and make a face mask that way. You could couple that with glasses. You may not need glasses, but if you buy the zero strength throwaway glasses that you can wear in the store, that is some protection, because what you're doing by these techniques is actually keeping yourself from touching your face, as Dr. Saag has said. The other thing is using hand sanitizer. Hand sanitizer is important. If you can't find hand sanitizer, you can again make your own. Get some alcohol. It needs to be 2/3 alcohol and 1/3 of something like an aloe gel. And you can make your own hand sanitizer. You can also wash your hands, do the 20-second hand washing technique, and use the gloves. And let your clients know you're going to social distance, you're going to help them as can be. You can also ask your clients to also wear PPE. So if it's homemade, you will have the access, as will they. This may not be a perfect situation. And I would say, yes, you might need to advocate for yourself and speak up. But our goal here is to help each other through this crisis while also staying healthy. So I think all of what we're trying to share here as a team is allowing you to keep that balance up in your life, to keep doing what you can do, which is so beneficial to people, but also take care of yourself. And when you do leave work, change your clothes, take off these devices, take your shower, and then go spend time with your family.
So
Be safe.
important. Yeah, so important, Dr. Alexander. Thanks a lot for that. Another great discussion, because you, of course, provided a lot of good questions. Here's a reminder for you at home. If there are questions you would like for our doctors to answer in our next episode, message your local Nexstar station on social media or send an email to coronaquestions@nexstar.tv. Got to say thank you to our amazing panel of doctors, our regulars, Dr. Saag, Dr. Alexander, Dr. Ali, who joined us for the second time this week, and Dr. Brown. If you want more about them, check out their bios on your Nexstar station's website. Remember, as always, you can stay on top of the latest COVID-19 updates by visiting your local Nexstar station's website. And don't forget to download their app. Thank you for joining us for this Saturday edition of Coronavirus House Calls. Do all you can to keep you, your family, and others safe. We hope to see you back here tomorrow for another Coronavirus House Calls. Enjoy your Saturday.